Hello, I am Dr. Pujan Parikh, consultant pulmonologist and sleep medicine specialist at Sir H. and Reliance Foundation Hospital. I will be talking about inhaler therapy, use of inhaler therapy in asthma. Inhaler therapy is an important mode of drug delivery for asthma. Basically, it is the first line of management as per the GINA as well as GOLD guidelines for the asthmatic and the COPD patients. Advantage of this inhaler therapy is that you need a lesser dose, you get a better efficacy. This drug is directly delivered into the airways and has a less of a systemic side effects. This is the main advantage of the inhaler therapy. The only disadvantage is patient has to take it properly, otherwise this medicine will not be properly delivered into lungs and will not have a effect. So basically this inhaler therapy is a method of drug delivery only directly into the lungs. So this inhaled therapy can be delivered by three ways. One is MDI, second is DPI, and the third is nebulization. I'll first talk about MDI. MDI is a meter dose inhaler. So this is what we call it as a MDI. It has a canister. This is the canister which contains the medicine. How to take it properly? So first patient has to shake it properly before taking the inhaler. Then patient has to breathe out. Then keep this inhaler in the mouth and close it properly. And a patient has to press this inhaler and at the same time take a long deep breath and hold the breath for 10 to 15 seconds. So this is how the MDI should be taken. So now what is the advantage and disadvantages of this MDI? So MDI is easy to use, but the issue is those who are in the pediatric age group, those who are elderly will not be able to coordinate it properly. Patient has to take a long deep breath along when the inhaler is pressed. So if that is not done properly, the drug will not be delivered properly. So now there is a solution for this. You can use the spacer. So this is how the spacer looks like, and we have to attach the inhaler to one side like this and keep the other side, that is the mouthpiece, in mouth and press the inhaler 1 or 2 times as prescribed by the inhaler, and patient has to take a deep breath, hold the breath for a couple of seconds, then patient can breathe out in the same device, then can do it 4 to 5 times so that the entire drug gets delivered into lung properly. So this spacer basically it retains the medicine so that if the coordination is not proper, when we press the inhaler, the medicine will come into this box and patient can take it, breathe in and breathe out for 4 to 5 times, and the drug will be properly delivered. So this is very useful for the pediatric and the elderly population, those who are not able to coordinate their breath when the inhaler is pressed. As per the GINA guidelines, this can be used in asthma attacks also. It is as good as a nebulizer in delivering the drug. Now there are different other types of MDI devices which we have. This is called as synchro breath, where patient don't have to press the inhaler. Patient just have to keep this inhaler in mouth and take a long deep breath so that the device will automatically release the medicine. So now the second drug delivery method is the DPI. There are various devices which can be used in the DPI. DPI is basically dry powder inhaler. So this is the Reliance and this is the other Lupiheller device. Now we have to basically take a capsule which contains a powder and put it in this device and close it. First patient has to breathe out like as I said earlier in the MDI device, and keep it in a mouth and take a long deep breath and hold the breath till patient can hold, and take a long deep breath and hold the breath for 10 to 15 seconds. This is the other Lupiheller device. Now, what is the advantage and disadvantage of this DPI? DPI is a very small device. You can carry it anywhere, easy to use. However, you need a good patient needs to take a long deep breath. Patient has to properly inhaled, otherwise the medicine will get deposited only in the throat or in the oropharynx only. So the other disadvantage of this DPI is this capsule is very sensitive to moisture, so it becomes very soggy if you keep a bottle of the capsules open. Now coming to the nebulization therapy. Nebulization is the therapy which we usually use it in the hospital, or a patient is having very severe asthma attack, or patient who is suffering from the severe asthma. Now the advantage of this nebulization is there is no coordination required. Patient just has to take a deep breath and breathe out. Now the issue with this nebulization is it's really very costly. It's a very time-taking process. Patient has to attach the device and put the nebulization liquid in the machine, and it goes on for 10 to 15 minutes. So if patient is advised to do it for 3 to 4 times a day, it's a very time-taking process. So this is how the 3 different inhaler therapy works. The important thing in this inhaler therapy is there is a lot of taboo in India that this inhaler therapy will make the person addicted to the treatment, but that is not true. As I said earlier, the dosage is very minimal and it goes directly into the lungs, so it has a very minimal systemic side effects. So this is the first line of treatment for all the asthma and the COPD patients, and this is the best which we can suggest for any of the patients suffering for the asthma. Thank you.